My name is Ahad Khan. I'm a general and bariatric surgeon here at IBI Institute. Today we're going to be talking about robotic surgery, the benefits, the side effects, the advantages, disadvantages, and what is incorporated into a robotic surgery. So I initially picked up robotic surgery, I want to say about 7 years ago, when it was just beginning to pick up in some specialty fields. I mean, urologists have been using it very successfully for greater than 10 years, and gynecologists have adopted it. And slowly, different specialties like colorectal, cardiac surgery, even some pediatric surgeries are being done robotically. So my interest gradually deepened towards robotic surgery, more so for being inquisitive and stuff like that, because the literature was very promising. So I started with bread and butter variety kind of surgeries to get used to the equipment and to get to know the machine. And we started with, gallbladders and hernias and stuff like that. In particular, hernias, inguinal hernias and incisional or ventral hernias, it's truly an amazing tool to have in your armamentarium, because it really helps you to accomplish things that you cannot do, or it's very difficult to do it with the straight sticks, or what we call advanced laparoscopic surgery. In robotic surgery, one of the advantages I personally feel is the physical nature of the surgery to some extent, or to a big extent, is taken away from you, because you're actually sitting on a console controlling a big machine which is taking all the weight off of you with little joysticks. Now, granted, it has a very steep learning curve. It's not a very easy tool to learn, but once you get past that first 15-20 cases of the learning curve, then it gets relatively very straightforward and easy and actually fun. So, like I mentioned, physician fatigue is eliminated from this, and there is good literature available that the requirements for pain management for, say, after a big ventral hernia has gone down dramatically. I personally don't prescribe much narcotics after ventral hernias and inguinal hernias, and that's one of the advantages. The other advantage is the initial downtime from big ventral hernias has significantly gone down for patients returning to work and returning to normal activities. Now, there are some counter arguments about using robotic surgery, some of it which is the increased expense. Granted, there's an initial investment which is usually made by the hospital systems to buy the robot. It's anywhere close to $2 million, and of course it comes with its maintenance also. But once you get past your learning curve, and once you have patient satisfaction, now if you don't offer robotic surgery, some patients would only ask you to be seen by a robotic surgeon. So it's a good asset to have if you are a robotic surgeon, so you can offer to your patients also.